Hi everyone, this is Mr. Neil Wrighter, also known as the Wax Whisperer. Thank you for tuning in to my latest video. So, for a patient who attended with bilateral, fully blocked ears, in the right ear, which is the ear that we're in at the moment, the patient actually had a condition called keratosis obturans. Whereas in the left ear, the patient had fully blocked earwax. And almost immediately after I inserted the suction probe, more about the texture and the feel of this plug of debris in front of us, I was able to distinguish between earwax and keratosis obturans. So earwax is a combination of dead skin, an oily sweat, and an oily fatty secretion, all amalgamated together, so it's a combination, whereas keratosis obturans is just a plug of dead skin, keratin, that hasn't migrated from the ear. And dead keratin, it's hard to explain, but you just get that feel once you're in the ear, and because they look almost identical. You'll see this and you'll see the patient's left ear. They look almost identical in their appearance, but this is just a collection of dead skin that hasn't migrated from the ear, and it's formed into a plug, and this plug is expanding, forever expanding in the ear, and it's actually caused a widening of the medial canal wall near the eardrum, so the bony part. Now you can probably saw some blistering, some blood on the right hand side. That's nothing that we did. As I said, with keratosis obturans is dead skin, and a lot of this dead skin is attached to the ear canal, and as you remove a plug of dead skin, it can cause blisterings. That's all it is. Now the patient had a really impacted plug of dead skin, really medial near the eardrum. I managed to remove the outer plug using an ear hook, but this was a bit more tricky. Now, patients who attend with keratosis obturans generally exhibit severe otalgia, earache. I would say probably all of my clients who have treated for keratosis obturans attend with severe earache. So we just have to be very careful and gentle. The patient coming in was very anxious because of the pain. We discussed even before we started possible onwards referral to have this removed either via local anaesthetic or a general anaesthetic. The patient decided to proceed. I just going back with microsuction, you can see that this is really attached to the canal walls, and this plug of skin is enveloped by the canal because this medial plug of dead skin is just expanding and widening. It's actually widening the ear canal, the bony part, and then the ear canal in front of it is narrower. So this is engulfed, and this is a good example here. So I'm just managed to rotate this plug of dead skin. I'm lifting it upwards, and you can see at the bottom where the ear canal has almost engulfed this plug of dead skin. Nonetheless, I've managed to remove this. We would classify this as a grade 2, I would say, keratosis obturans. You get different gradings. Grade 1 is mild pain, whereas grade 2, you'll consider it more of a moderate to severe pain, which is what the patient was experiencing, and a mild expansion of the bony canal. So the bony canal is slightly expanded because of the compression of this dead skin. As it's developing and forming and getting bigger, the plug, it pushes open and expands the ear canal. So the patient's symptoms more or less are alleviated here. However, there's some dead keratin still on the superior roof of the ear canal, and also some on the eardrum. And whilst the patient's here, I'll just explain to the patient, let's just try and get this out, because it's not going to come out on its own accord. So patients who suffer from keratosis obturans have lost their ability, or their ear, should I say, has lost the ability to naturally shed and migrate any dead skin. So the ear canal and the outer layer of the eardrum is made up of 3 membranes. The outermost layer is the same skin that coats the inner 2/3 of the ear canal. It's a thin, very thin layer, less than 0.1 millimeters in thickness, of what we call stratified squamous keratinous epithelial skin. And as the skin dies and sheds, it should move sideways outwards out of the ear, almost like a conveyor belt motion. And as it does, any wax that's sitting on the surface of the skin is also removed automatically. However, this patient in this particular ear has lost their ability, or their skin has lost the ability to naturally shed and migrate. So instead of the skin, as it's dying and shedding, coming out of the ear, it's just collecting. So this is a fresher layer of dead skin, so you can tell by the colour it's not as dark as the remaining plugs. So as the skin dies and sheds, the longer it's been in the ear, it oxidizes. So on the perimeter, on the edge, and you can see this on the eardrum as well. I think I'm going to go in a moment to remove this off the posterior aspect of the eardrum, so just here. This is more of a fresher layer of dead skin. It's oxidized, you can see it's a bit more golden in colour, and the lighter, paler yellow is a fresher layer of skin. So we're going to be really careful here because it's stuck to the drum, so I'm just gently peeling this. We don't want to rupture the eardrum. So again, we're really delicate. And I said the reason why I removed this is because it's not really going to come out itself. This patient has got this condition. They require a regular clean. You can see I've bent the fine end gorge there. It's just when I was removing the dead skin off the anterior canal wall, I just needed that angle. I managed to do that, and at this stage I'm happy. So ideally we want to get every little speck out, but that's just not possible. The patient's going to be using regularly instilling sodium bicarbonate drops, which I find is much better for dead skin than olive oil, which is what I typically recommend, and they've been advised to attend regularly. Now it's the patient's left ear. I would say this is more earwax than dead skin. And I can just tell by the texture, it's a slightly different texture, but this is just as badly blocked, if not medially. It's not causing any expansion of the ear canal at all. So immediately, because it's really plugged, I just put some olive oil drops in, and we're just lateral, we're near the entrance, you can see the hairs there. And I'm just going to detach this plug of wax, and I thought the oil would help. I'm just lifting it trying to lift it off the back part of the ear canal and off the base. You can see the hairs there, but this wasn't budging at all. I could be here all day, I feel, with a suction probe performing microsuction, but this wasn't going to come out. And in a moment I'm going to resort to an ear hook. Again, I'm just trying. Quite typically, wax plugs and plugs of dead skin are adhered to the back part of the ear canal near the entrance. If you lift it off the canal wall there, it just facilitates the rest of the removal. You can still occasionally let it slightly smear it just because of the hairs there. Quite often people ask why we don't trim the hairs. Well, the hairs actually have a function. They filtrate the air going in, and they also secrete the natural oils and sweat, which is actually useful. Earwax is actually good for us, believe it or not. So we do want a bit of earwax, and these hairs actually produce. So at the root of these hair follicles, you have sebaceous glands, which secrete a substance called sebum, and it's the same oily, fatty secretion we have on our scalp. And we also have modified alpocrine glands, modified sweat glands, the same sweat glands we find in our armpits. So this oily sweat, fatty secretion combined with dead skin actually forms wax, and wax is acidic, inhibits bacterial growth, acts as an irritant repellent. It's greasy, oily, so it acts like a natural moisturizer for the skin. And it's sticky, so any foreign particles that enter the ear stick to the wax, and as the wax generally comes out in most people, it cleans the ear naturally. You can see how we used the ear hook there. I just rotated it at the base, got it underneath, managed to hook it out. The patient's got a very bendy ear. I don't know if you saw the architecture of that ear. Measured all the goods, should I say. You can see the plug on the right on the scale. That's from the left ear, the really dark plug of wax. Measured over 0.5 gram, so 556 milligrams. I hope you enjoyed that video, guys. Take care. Bye.